Welcome to this session on the structure of policy. By the end of this session, you will be able to 1. Identify and describe the key components of a well-structured policy document. 2. Understand the purpose and importance of each section within a policy. 3. Appreciate how a clear policy structure facilitates effective policy development, communication, and implementation. The structure of a policy typically includes several key components to ensure clarity, consistency, and effective implementation. While the exact format may vary depending on the organization or context, a well-structured policy generally includes these key elements. Let's look at them. Let's begin with the simple truth. Structure matters. A well-structured policy offers clarity by clearly defining goals, actions, and responsibilities. Alignment by ensuring all stakeholders work toward common objectives. And effective implementation by translating vision into actionable steps with measurable results. Without a strong structure, even the best intentions can get lost in translation. A standard policy document usually includes 5 key sections: title and introduction, scope, objectives and guidelines, implementation plan, monitoring and evaluation. Let's unpack each of these with examples to illustrate how they work in practice. Component 1. Title and introduction. The title is the policy's identity, and it should be crafted carefully. A good title should be clear and concise. It should immediately convey the policy's subject matter without requiring explanation. Specific. Avoid ambiguity at all costs. Descriptive. Give readers a hint about the policy's main focus or intent. The title should prepare readers for what they'll find in the document. The introduction sets the stage for the entire policy. It's your opportunity to create understanding and buy-in from the very beginning. A strong introduction typically includes background, problem statement, justification, vision statement. Let's see how this works in practice. Kenya's National Education Policy Framework begins with a description of education system challenges such as low transition rates to secondary school and inadequate infrastructure. The government's commitment to aligning education with Vision 2030 and the Sustainable Development Goals. A clear purpose statement to guide reforms that ensure equitable access to quality education for all Kenyans. Component 2. Scope. The scope defines the boundaries and reach of the policy. The scope answers 3 critical questions. Who does this policy apply to? What activities, sectors, or geographical areas does it cover? What does it not cover? Here is an example to demonstrate scope in action. South Africa's national gender policy provides an excellent example of clear scope definition. Who? The policy applies to all government departments and agencies at every level. What? It addresses gender equality, specifically in employment, education, and governance, not every aspect of gender relations. Where? It operates at national, provincial, and local government levels, creating a comprehensive but bounded approach. Component 3. Objectives and guidelines. This component has 2 interconnected parts that work together to provide direction. Part 1. Objectives. Objectives are specific, measurable, achievable, and time-bound goals that the policy aims to accomplish. For instance, to reduce the national unemployment rate among youth aged 18 to 35 years by 10% within 5 years. Part 2. Guidelines. Guidelines are the overarching rules, values, or principles that will govern the implementation of the policy. They provide a framework for decision-making and ensure consistency across different contexts and implementers. For instance, all policy inventions shall adhere to principles of equality, transparency, and community participation. These guidelines ensure that, however the policy is implemented, it maintains certain core values. Here is an example of objectives and guidelines at play. Nigeria's health policy demonstrates how objectives and guidelines work together. Objectives: achieve universal health coverage and reduce maternal mortality by specific percentages within defined timeframes. Guidelines: focus on strengthening primary healthcare systems, ensuring equitable access, which means that all implementation decisions should prioritize these approaches. Component 4. Implementation Plan. The implementation plan is where vision meets reality. It outlines actions, timelines, and responsibilities, specifies resources required for implementation, and identifies key stakeholders and their roles. Rwanda's community health policy provides an excellent example of a detailed implementation plan. Action: deploy community health workers in every village, train them in basic health services, and establish referral systems to health centers. Timeline: a 5-year rollout plan with annual targets for training community health workers, establishing cooperatives, and expanding coverage. Responsible parties: the Ministry of Health provides overall coordination, local governments handle recruitment and training, and community organizations support ongoing operations. Botswana's HIV and AIDS policy M&E framework includes quarterly progress reports that track immediate outputs like the number of people tested or treated. Key indicators like HIV prevalence rate and treatment access that measure longer-term outcomes. Annual stakeholder reviews to adjust strategies based on what the data shows is working or not working. Crafting a well-structured policy document is a critical endeavor for any organization or government. By carefully considering each element, you can ensure that policies are effective, efficient, and achieve their intended outcomes. Remember, good structure isn't about following rules. It's about creating clarity, alignment, and effectiveness. The African examples we've seen today show how this framework can be adapted to different contexts while maintaining its core logic. In our next session, we'll explore how policies are implemented, the critical bridge between policy design and real-world impact.